The battle over health care in Washington only intensified this week, coming out of a record-long federal government shutdown. It's at the center is whether Congress will extend the Enhanced Affordable Care Act subsidies, which keep premiums lower for roughly 22 million Americans. That fight over the ACA subsidies is just the latest reminder that health care has always been a political tinderbox. Let's bring in Dr. Daniele Fallin. She is the Dean of Emory's Rollins School of Public Health to help us understand why this issue sparks such intense debate year after year after year. Welcome to the show, Doc.
Thanks so much. It's great to be here.
All right, let's start with that. Let's start with why the healthcare consistently becomes such a political battleground in the United States.
Yeah, it's interesting. Honestly, while health and healthcare have always been political in the sense that a lot of our tools for making ourselves and our communities healthy are through legislation or quality standards and things like that, we haven't seen the polarization attached to health and healthcare until the last decade or so, at the severity that we feel it now. And, there are lots of reasons for this, I believe, but we see in all sectors of our society now that we are getting information within silos. We're sort of self-selecting and curating what we hear and what we know, and we're spending time with folks with similar thinking. And so we're not getting exposed to folks who think differently or hear different kinds of information, and that just makes that polarization worse.
How much do you think of this is rooted in politics, or it's just rooted in personal experience or fear of losing coverage?
Well, I think all of us care about health. I think the idea that you want your family to be healthy, the people that you love, your friends, your neighbors to be healthy is not political and is not partisan. I think what we're seeing that's different is what are the solutions or what are the tools that would help us achieve that kind of health for our families and for our communities. And that's where we see that this polarization is really mattering. It appears that it's no longer as easy to come together and have a reasonable conversation about how you would achieve that community's best health and bring different ideas to the table, listen to each other with curiosity, and then find some common ground to move forward. That's the piece that I think we're now missing.
Seems like affordability remains such a sticking point, right? Even after we've had all these years and years of reform, like why is it such a sticking point even now?
Yeah, it's true. And I think if we all could think through the challenges, a lot of the conversation has been cast around the individual, which is absolutely true. If I don't have insurance, it's going to be harder for me to get care. It could be a financial challenge for my family if I do get sick and then have to pay out of pocket for things. But if we think about our whole communities, or actually our healthcare system in this country, if we do that at scale and folks cannot get preventive care or regular care, they're going to only come into our systems when they have an emergency or when they're really sick. So that will flood our emergency departments. Often those folks, because they are so sick, will need hospitalization. That could flood our hospitals. And so in the end, not providing health care to everyone creates a bigger financial and access barrier than if we just provided that affordability to begin with. So it is an individual issue, but it's also a systems issue.
Yeah, you spoke about this debate, amping up over time. Has been polarized over time, or does it seem like it's a simple, more of a heated? It's more simply heated because of the subsidy fight?
I don't know that I would say that it's more heated because of the subsidy fight, but certainly when folks are looking at, oh my gosh, what is my premium going to be next year as I'm signing up for my new healthcare plan, folks are realizing this could jeopardize my ability to keep myself and my family healthy, or it could jeopardize my financial stability. And so when folks feel that kind of passion about their own selves and their communities, that leads to a kind of emotional response to things.
What kind of lessons should policymakers carry forward from this shutdown and now on to this subsidy fight?
I think the issue is what we've been working on in our School of Public Health, and I think what many folks are working on across the country, is we have to get back to listening to each other and finding common ground. If we start with the premise that everyone wants to make a healthy country, and what we really disagree on is the strategy to get there, then we can find pieces of those strategies that we agree on and work through those to move forward, rather than entrenching and sort of saying, I'm only going to do this one thing, or I'm only going to do that one thing. That kind of dialogue is what is been missing and what we really have to encourage our legislators and our own communities to do more of.
Yeah, given the history, the politics, the human impact, what do you think it's going to take for this country to finally move forward with a more stable and less decisive conversation about the whole matter?
Dialogue. Listen with curiosity to your neighbor. Assume the best intent. Assume your neighbor also wants you to be as healthy as you want you and your family to be, and that the disagreement is really about how to get there, not whether we really want the same things.
Gotcha. Dr. Daniele Fallin, thanks so much for joining us. Really appreciate your insight this morning.